This is Priscilla Fong, and I'm the Policy Director at the Asian and Pacific Islander American Health Forum. We're so pleased that you're joining us today, and happy Asian Pacific American Heritage Month to everybody. I'd like to welcome you to today's webinar entitled The Healthcare Law and You, How Does the APA Help Asian Americans, Native Hawaiians, and Pacific Islanders? This webinar is presented by the White House Initiative on Asian Americans and Pacific Islanders and the Asian and Pacific Islander American Health Forum. Before we begin, I'd like to take care of some housekeeping items. First, today's webinar is closed to the press, so any press on the call, please note that this information is just for informational purposes only. All participants are currently muted and in listen-only mode. Due to the number of participants, we won't be able to unmute the lines, later on, but we will provide instructions for you to enter questions in a question box, and I will facilitate those questions and direct them to the appropriate speakers then. And lastly, please note that this webinar is being recorded, and we hope to make it available soon. So, as we celebrate the achievements and accomplishments of the Asian American, Native Hawaiian, and Pacific Islander community this month, we also want to take this time to recognize the important impact that the Affordable Care Act, our nation's historic health care reform law, is having and will continue to have on our communities. The law makes numerous coverage expansions and significant investments and reforms that provide a pathway for reducing racial and ethnic health and healthcare disparities. We hope that the information provided in today's webinar will help you learn more about these important provisions and ways you can help ensure that community members receive the care that they need. We have a fantastic panel of experts joining us today, beginning with Kathy Lim Ko. So Kathy will provide an overview of the current state of health insurance coverage within the Asian American, Native Hawaiian, Pacific Islander community and highlight some of the important ways that the ACA will help close these coverage and disparities gaps. Kathy Lim Ko is the President and Chief Executive Officer of the Asian and Pacific Islander American Health Forum, a national health justice organization which influences policy, mobilizes communities, and strengthens programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. Kathy has worked in senior management positions in community-based and philanthropic organizations throughout her 30-year career, including the Community Clinics Initiative, a joint project of TIDES and the California Endowment, Asian Health Services, and Planned Parenthood San Francisco. Next, we'll hear from Myra Alvarez, who will be talking about the benefits of the healthcare reform law and share some new estimates about the impact of the law on Asian Americans and Pacific Islanders, which was released last week by the Office of the Assistant Secretary for Planning and Evaluation. Ms. Alvarez is the Director of Public Health Policy in the Office of Health Reform at the Department of Health and Human Services, where she has primary oversight responsibility for coordinated and timely implementation of the public health, prevention, and healthcare workforce policy provisions in the Affordable Care Act. Previously, Ms. Alvarez served as a legislative assistant for Senator Dick Durbin, the majority whip of the U.S. Senate, where she advised the senator and helped develop his legislative agenda on health issues. Prior to working in the office of Senator Durbin, she served as a legislative assistant for then Congresswoman Hilda Solis, the chair of the Health Task Force for the Congressional Hispanic Caucus. Ms. Alvarez began her work in Washington, D.C. as a David A. Winston Health Policy Fellow in the office of then Senator Barack Obama. And last but not least, we will hear from Dr. Tong Nguyen, who will talk about the White House Initiative on Asian Americans and Pacific Islanders and its efforts to outreach to Asian American, Native Hawaiian, and Pacific Islander communities about the Affordable Care Act. Dr. Nguyen is a member of the President's Advisory Commission on Asian Americans and Pacific Islanders and is a professor of medicine at the University of California, San Francisco, where he provides medical care to a diverse patient population and teaches clinicians. He also serves as director of the Vietnamese Community Health Promotion Project, principal investigator of the Asian American Network for Cancer Awareness, Research, and Training at UCSF, and in this role conducts research in healthcare prevention for Asian Americans. He has worked on studies to include breast, cervical cancer, and colorectal cancer screening among Asian Americans, as well as on tobacco use among Asian Americans. So with that, I would like to turn it over to Ms. Kathy Lim-Ko.
Thank you, Priscilla. I'm so happy to be online with my close colleagues and very well-respected experts on this area. Can everyone hear me all right? Okay. So first, I wanted to introduce the Asian and Pacific Islander American Health Forum. Our mission is to influence policy, mobilize communities, and strengthen programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. We have worked very steadily on not only getting the Affordable Care Act passed, but also in really working very closely with the Department of Health and Human Services in commenting and helping to shape the regulations so that they can be as responsive as possible to all vulnerable communities, and especially Asian Americans, Native Hawaiians, and Pacific Islanders. Next slide. I wanted to first start with a profile of the uninsured in our communities, Asian Americans, Native Hawaiians, and Pacific Islanders, and then we can look to the benefits of the Affordable Care Act. So there are estimated nearly 47 million Americans who are uninsured. That represents 1 in 7. And in the Asian American, Native Hawaiian, and Pacific Islander communities, we have higher rates of uninsurance, 1 in 6. Individuals who are uninsured are more likely to lack a regular source of care, and Asian Americans, Native Hawaiians, and Pacific Islanders are less likely to use or receive preventative services or access timely appropriate care. Next slide. As you well may know, Asian Americans and Native Hawaiians and Pacific Islanders are not a monolithic group. There are large variations in the type and rates of coverage among ethnic groups, and what we often see in the statistics around Asian Americans, Native Hawaiians, and Pacific Islanders is what is called a bimodal distribution. So some with a lot of coverage in this case, but also those without. For example, uninsurance rates are the highest for Bangladeshis, Cambodians, along with Koreans and Pakistanis, but the lowest for Japanese Americans. Asian American, Native Hawaiian, and Pacific Islander ethnic groups with higher socioeconomic status, such as Japanese, Asian Indians, Taiwanese, have higher health insurance coverage rates, especially with private insurance, while some Asian American ethnic groups with lower private rates, such as Hmong, Bangladeshis, and Cambodians, have higher public insurance rates. Native Hawaiians and Pacific Islanders have lower private insurance rates but higher public insurance rates than Asians and the general population. Next slide. When we look at healthcare coverage by age, we note that rates of uninsurance is the highest among Asian Americans and Native Hawaiians. For Asian American youth, it's 25%, and Native Hawaiian and Pacific Islanders, it's 38%. And this is very similar to the general U.S. population. Next slide. So, of course, the Affordable Care Act is the most sweeping health legislation in the last 40 years and will not only increase coverage in insurance, both public and private insurance, but we see that as an opportunity for increased access to health coverage as well. So an estimated 32 million will gain health care coverage both through Medicaid, expansion of Medicaid, as well as through expansions in private insurance, whether it be through an employer responsibility or the individual state health insurance exchanges. Beginning in 2014, qualified individuals with incomes of up to 133% of the federal poverty level will be under the expanded Medicaid coverage. Also beginning in 2014, individuals, families, and small businesses can purchase high-quality, affordable private insurance plans through new coverage marketplaces, I like to think of them as shopping malls, called either the Individual Exchange or the Shop Exchange that's targeted for small businesses. It's also important to highlight that the Affordable Care Act created new rules in the private market to help people get insurance and stay insured. This includes no discrimination for pre-existing conditions such as cancer, diabetes, and domestic violence. Next slide. In our Native Hawaiian, Pacific Islander, and Asian American communities, the Medicaid expansion will really represent a significant increase in coverage. Nearly 1 in 10 Asian American adults are likely to benefit, and even more so, 1 in 8 Native Hawaiians and Pacific Islanders are likely to benefit. Currently, Medicaid covers more than 850,000 Asian American and Native Hawaiian Pacific Islander children and 180,000 Asian seniors. We know that many more Asian Americans and Native Hawaiians and Pacific Islanders will gain coverage with expansion in 2014. Next slide. In 2014, Medicaid will be expanded to make coverage available to eligible individuals, including all adults under age 65 with an income of up to 133% of the federal poverty level, or about $30,000 for a family of 4 in 2011. Expanding Medicaid eligibility has the potential to reduce the uninsured rate among Asian American, Native Hawaiian, and Pacific Island adults, for whom the uninsured rate is currently almost 30% in some subpopulations. Most importantly, childless, non-elderly, and non-disabled adults, both male and female, will for the first time be able to gain Medicaid coverage. This is significant because Asian American, Native Hawaiian, and Pacific Islander adults suffer disproportionately from chronic diseases such as heart disease, obesity, and diabetes, and will be able to receive preventive care and maintenance treatment when enrolled in Medicaid under the expansion. Next slide. To help make private health insurance more affordable, the Affordable Care Act also provides individuals and families with incomes up to 400% of the federal poverty level with a premium tax credit, it's also called subsidies, to purchase plans offered through the individual exchange. Small businesses will be able to take advantage of opportunities in the SHOP exchange with, for those small businesses that have between 1 and 25 employees and are already eligible for a tax credit to help them purchase health insurance for their employees. Next slide. One element of the Affordable Care Act that we've been very excited about and have worked tirelessly on, and in particular I want to acknowledge Priscilla's engagement in Section 4302, has been an improved data collection. In addition to providing more affordable options to health insurance, this provision seeks to reduce racial and ethnic health disparities by collecting data, by requiring that all surveys administered by the Department of Health and Human Services standardize and collect data on race, ethnicity, sex, primary language, and disability status. The Department of Health and Human Services finalized these standards in October of last year, and it currently applies to all federal population surveys. We're really pleased that for the first time, there'll be data disaggregated, collected in a disaggregated fashion for Asian American communities, in particular in these 7 categories, Asian, Indian, Chinese, Filipino, Japanese, Korean, Vietnamese, and other Asian, and also in Native Hawaiian and Pacific Islander categories of Native Hawaiians, Guamanian or Chamorro, Samoan, and other Pacific Islanders. Next slide, please. We have a wealth of resources and have had this over the last 3 years on our website, so please go to our website at APIAHF.org. There is a healthcare reform resource center with many briefs, data, a lot of analysis that's available. We also have some briefs that are analyzed by state level. So we hope that the Health Forum can provide a lot of helpful information and resources to the communities as you work in your states on implementation plans. Thank you very much.
Great. Thanks, Kathy, for that. Next, I'd like to turn it over to Myra Alvarez.
Thanks, Priscilla. Hi, everyone.
Uh-oh. Myra, we're having some trouble hearing you.
I think there might be an echo.
Okay.
There is an echo.
Uh-oh.
Is anyone else hearing an echo?
Mute the computer, the audio on the computer. See if that helps.
However, if Myra, if you entered the audio pin and muted your computer, then you just muted yourself.
Okay, can you hear me now?
Yeah, that's better.
Okay, then let's try it again. Hi, everyone. My name is Myra Alvarez. I'm here at the Office of Health Reform in the Department of Health and Human Services, and I'm excited to be here with you today to talk a little bit more about the health care law, the Affordable Care Act, and specifically the brief that we were able to release last week that contains important information for the community to learn about how the law will impact Asian Americans and Pacific Islanders and Native Hawaiians across the country currently and in the future. Next slide, please. The first question a lot of people have across the country is, why do we need the health care law? And really, the answer is that before this law was enacted, we had a health insurance market that worked very well for big insurance companies, but it didn't work very well for everyday Americans and for American families. We had insurance companies that could pick and choose who they gave coverage to, premiums were skyrocketing, insurance companies were making record profits, and really, many of us, we didn't have the security that our health insurance is supposed to provide us. In total, 50 million people were uninsured, but tens of millions more had coverage that didn't cover certain treatments or had a policy that we didn't understand what services were covered. And many of us were afraid that we would lose our health care coverage if we changed our jobs or if we moved or if our employer decided to drop that coverage. And for minority populations, it was worse. You heard Kathy discuss a little bit of the numbers regarding Asian Americans, Native Hawaiians, and Pacific Islanders, and those numbers really translate into real lives. Not only are communities of color more likely to be uninsured, they lag behind in almost every measure of health. So they're less likely to get the preventive care they need to stay healthy. They're more likely to suffer from serious illnesses. And when they do get sick, they actually have less access to the treatments and medicines they need to get better. This is really the huge impetus for why the Affordable Care Act is so important for communities of color and communities like Asian Americans, Native Hawaiians, and Pacific Islanders. Next slide, please. So over the next few minutes, I'm going to just talk a little bit about what this law means to the community. The healthcare law builds on what works in our healthcare system and specifically aims to improve 5 key areas. That's protecting us from worse insurance company abuses, making healthcare affordable, strengthening our Medicare program, giving us better access to care. And together, these will make us go forward in eliminating health disparities. So I'm going to talk a little bit more about each of those and talk about the report that specifically describes the impact in the Asian American, Native Hawaiian, and Pacific Islander community. Next slide, please. So like I said, in the past, insurance companies could take advantage of Americans, denying coverage to children who were born with a heart defect or living with arthritis, or an adolescent that is living with depression. You know, for children from racial and ethnic minority populations who are actually more likely to have chronic conditions, insurance companies could turn them away. So these are the young people that we obviously want to take care of the most, as they're our future generation, and insurers were free to turn them away. But insurance companies could also put a lifetime dollar cap on the amount of care they would pay for. So if you developed a serious condition like cancer or a rare blood disease, or if you were even injured in a car crash, your insurance could actually disappear when you needed it the most. And I think worst of all, we could have our coverage canceled when we got sick if our insurance company found an accidental mistake on our paperwork. You know, some companies could even go through records of people who were breast cancer survivors or living with HIV and specifically look for those that made errors in order to kick them off. What this law does is create a patient's bill of rights that puts your needs first and protects you from these abuses. Next slide, please. The second way that the law helps is by bringing down healthcare costs and making sure that our healthcare dollars are spent wisely. So before the law, private insurance companies spend almost half your premium on overhead, like marketing, CEO salaries, other administrative purposes, really leaving only 60 cents to spend on actual healthcare services. But what we try to do with the law is put a fair value on your premium. We've created the new 80-20 rule, which requires insurance companies to spend 80% of your premium on actual healthcare services or improving care. If they don't, they actually have to repay the money. Recently, you might have seen a Kaiser Family Foundation report that was released that estimates that companies will actually be just issuing $1.3 billion in rebates to consumers because of the new 80-20 rule. It's exciting information that we want to make sure Americans are aware. The second way, obviously, is rate review. What this tries to do is put some transparency into the health insurance system. I think all of us, on this line know a personal family member or a small business owner who has seen their insurance premium go up astronomically and never understanding why. Now what we're trying to do is just put some transparency into the system by saying to insurance companies that they have to publicly justify their actions if they want to raise their premiums by 10% or more. Again, providing you, the consumer, the information you need. Next slide, please. And then finally, of course, strengthening Medicare. Nearly 50 million seniors and Americans with disability depend on Medicare every day, and I think many of us that don't have Medicare today, one day will plan on depending on it. So what we try to do with the Affordable Care Act is strengthen Medicare. For example, making key preventive services available with no copay or deductible so that no senior has to skip a potentially life-saving screening for fear that they couldn't afford it. Second, we give relief to people in the Medicare Part D prescription drug coverage gap, or what you all know as the donut hole. Before the law, seniors that reached this donut hole had to cover all of their out-of-pocket costs, often between $2,700 and $6,100. Now we're able to give them a 50% discount on covered brand name medication, and we'll ultimately close that gap in 2020. Because of the Affordable Care Act, in 2011, we were able to save seniors in the donut hole an average of $600. $600 that they had back in their pockets to buy groceries or spend on their family or pay a bill, and not have to worry about where they were going to get the money to cover their drugs. We crack down on efforts to battle Medicare fraud so that we are protecting the program for the long term. And we also are implementing new tools to make it easier for doctors to work together to coordinate care. Just this week we released our Innovation Challenge Award recipients to try and identify new ways that communities can educate the federal government about how to deliver health care better, more efficiently. We're excited about the outcomes of those and seeing them develop over the next couple of years. And finally, what I want to emphasize is that these changes, the cost savings, the efforts to crack down on fraud really are improvements to extend the life of the Medicare Trust Fund, making an overall stronger Medicare program to better meet the needs of our seniors. Next slide, please. And then finally, the law obviously does improve our access to affordable care. If you take into consideration young adults across the country, they historically have had some of the highest rates of being uninsured. Most young people lose their family coverage when they graduate high school or college, and it's often a few years before they get a job that offers them good quality health insurance. So this means that in that period of time, if they're diagnosed with a serious illness or in a serious car accident, they could go broke, or their families could go broke, just by trying to cover the services that they need to stay healthy. So now the law provides young adults to actually stay on their parents' plan up until age 26, a change that's allowed obviously 2.5 million young adults to get the health care coverage. We've also been able to create a pre-existing condition plan in all 50 states, offering Americans with pre-existing conditions that prior to the law really had nowhere to turn when it came to the private market. It was just they were consistently being able to be turned away. In 2014, we'll outlaw that practice. But between now and then, we do have a PSIP program, available. You can find more information on psif.gov to offer people an option for coverage. So if someone is living with mental illness or has a history of substance abuse and wants to be able to access health insurance, they now have somewhere to turn. Again, in 2014, we'll outlaw health insurance companies' ability to turn people away. We're removing cost-sharing requirements from preventive services. So no one has to fear of a $30 or $40 copay to go in for a checkup. This is particularly important for, again, minority populations like Asian Americans, Pacific Islanders, Native Hawaiians that disproportionately are impacted by many chronic diseases that are often preventable. It's often going to the doctor early for that checkup, for the mammogram, for a screening colonoscopy, to identify these diseases early on so that they can then get the treatment necessary to lead a healthier life. And then finally, we know that we need to invest in our workforce. So we are supporting thousands of new doctors and nurses in communities around the country. And as a result, millions more patients are getting care. We're also investing in community health centers so that not only can we create new health centers in communities that need them, but that we are actually improving existing health centers that may want to add additional services like a dental chair or additional behavioral health care services so that they can better meet the needs of the communities that they serve. Next slide, please. And as Kathy mentioned, you know, the affordable insurance exchanges are going to be a critical piece of implementation to improve the health and well-being of Asian Americans, Native Hawaiians, and Pacific Islanders. In less than 2 years, we'll create affordable insurance exchanges to make it easy for you to compare and choose health plans, and to include some basic rules that are set up to protect you as a consumer. For example, no turning people away because of pre-existing conditions. Again, this is particularly important for communities of color that are disproportionately impacted by chronic disease. Or no charging women more just because they're women. There will be significant tax credits available for middle-class families to better afford health insurance. And again, as Kathy mentioned, Medicaid will be available for Americans living below 133% of poverty, or about $30,000 for a family of 4, including, for the first time ever, single childless adults. This is a particularly important movement for the communities that we serve in order to have an opportunity to access coverage. Next slide, please. But I want to emphasize that, you know, having an insurance card is obviously not going to automatically make us healthy. So the law does recognize that we need to invest in creating healthy communities. So we are investing billions of dollars in public health and prevention. Health disparities, health inequities across this country often persist because the root causes of chronic disease, they rest outside of that doctor's office. When we consider the impact of chronic disease on our families and on the economy, we know we have to work to prevent the onset of those diseases that are often preventable. And by doing so, we are often working in the community setting outside of the clinical setting. So the Prevention and Public Health Fund created by the law allows us to invest in these programs. Next slide, please. So we were excited to release last week a research brief from the Office of the Assistant Secretary for Planning and Evaluation that specifically highlights how it is that the Affordable Care Act impacts the Asian American and Pacific Islander community. You know, I want to emphasize these facts again because when we are talking about it in abstract terms and statute and looking at a law, we often lose sight that these are people's lives. And now, because of the implementation of the law, already approximately 97,000 young adults from the Asian American and Pacific Islander community who otherwise would have been uninsured have coverage under their parents' plan. 97,000 young adults can focus on that next step in their career. They can focus on going to graduate school or taking an internship that did not offer health coverage because they have somewhere to turn. If you look at preventive services and not have to worry about a copay or a coinsurance rate, 2.7 million people from the API community across this country with private insurance today no longer have to worry about cost-sharing requirements. again, we are able to emphasize that making that healthy choice is easy and affordable. You don't have to worry about whether you want to pay $40 for gas in your tank or $40 for your copay for your mammogram. 2.7 million people across the country don't have to worry about that anymore, and we have the opportunity to make that even a broader impact in the future. In our Medicare program, 867,000 beneficiaries in Medicare from the Asian American and Pacific Islander community have access to a stronger Medicare program. They have access to those free preventive services. They have access to a community of doctors that's going to focus on team-based care to ensure that they're taken care of. And then they have access to those important discounts once they reach the coverage gap known as the donut hole. Real differences that are happening for our Medicare beneficiaries. And then it doesn't stop there. In 2016, that's a couple of years after the affordable insurance exchanges are up and running, we are actually estimating that 2 million people from the Asian American and Pacific Islander community who would otherwise be uninsured are going to be able to gain or be eligible for new coverage because of the opportunities made possible by the Affordable Care Act. Because of the expansion of Medicaid, or because of this new health insurance marketplace that we're going to make available to Americans, 2 million people from the Asian American community who otherwise would be uninsured have an opportunity to gain health insurance. And as a result of that, are that much more likely to get a checkup, are that much more likely to identify cancer early, or to be able to seek preventive care services and not worry about it, and ultimately be able to contribute to society fuller, be able to pay attention in class, or have a more productive work week. And that's an opportunity that not only benefits the Asian American and Pacific Islander community, but benefits all of America. Next slide, please. And I know Kathy already mentioned the data collection efforts from the Affordable Care Act, but I want to count it as well because it is so important. How do we know who we are serving or how our programs can better meet the needs of our diverse communities if we can't define the communities that we serve? That's what it's about when it comes to Section 4302 and the new data standards. It's consistent methods for collecting and reporting health data across our HHS surveys so that we can better understand the needs of the people we serve. It's an exciting opportunity to define or to better define the populations we serve in order to really know the differences between the diversity that rests within the Asian American and Pacific Islander and Native Hawaiian community, because we all know they exist. And to better define those differences means that we can better target our resources, our programs, to improve the health of the community over the long run. Next slide, please. So as you think and talk about the law and learn more over as time goes on, I want to just remind you about the 5 key benefits. First, the healthcare law protects you from the worst insurance company abuses. It drives down costs. It gives us better access to affordable care, strengthens our Medicare program, and as a result, reduces health disparities. These efforts together really will advance this country's efforts to tackle health disparities and achieve health equity for all Americans. Next slide, please. And really, ultimately, what it means at the end of the day is that for the first time in our country's history, no matter what our situation is, we'll have the opportunity to get affordable health insurance and ultimately, again, be able to reach that American dream, fulfill our lives more healthily and successfully as well. Last slide, please. So the healthcare law really is a work in progress, but it's already made huge improvements that clearly over time are going to touch every American family in some way. I encourage you all to go to healthcare.gov to learn more information about any of the new benefits I mentioned. Also, our Minority Health website offers a tremendous amount of resources regarding the impact of the law on communities of color. And please stay engaged. We look forward to continuing to work with you.
Great. Thanks, Myra. That was a really comprehensive presentation and overview of the Affordable Care Act. There's a lot to look forward to. I'm going to invite Dr. Tang Nguyen to speak next.
Great. Thank you, Priscilla. On behalf of the White House Initiative on Asian Americans and Pacific Islanders, I want to thank Kathy and the Asian Pacific Islander American Health Forum for sponsoring this call with the initiative and for all the great work that the forum has done for the health of AAPI communities. And I also want to thank Kathy and Myra for the extremely useful information on the Affordable Care Act and its benefit for the AAPI communities. I just want to take a minute to tell you about the initiative, which was established by President Clinton, and after years of neglect by the Bush administration, established by President Obama. Reflecting the priorities of APIs in President Obama's administration, two cabinet-level leaders are co-chairs of the initiative, Cabinet Secretary Chris Liu and Secretary of Education Arnie Duncan. Kiran Ahuja is our executive director, and before coming to this position, she spent 20 years working for our communities and was the founder of the National Asian Pacific American Women's Forum. The initiative's leaders and staff are assisted by the President Advisory Commission, a group of 20 API leaders from across the country with expertise in a variety of fields. We currently focus on four major areas: economic and sustainable development, civil and immigrant rights, education, and healthy communities. The initiative's main goal is to ensure that the federal government work better for APIs by serving as a liaison between the communities and the federal agencies. Since President Obama reestablished the initiative, we have met with more than 25,000 community members in 26 states through venues such as summits, roundtables, and town halls. And we also conducted numerous teleconferences and webinars to increase knowledge of federal efforts that affect AAPIs. We have actively channeled concerns about policies that impact our communities to the federal agencies, and currently we're working with 23 federal agencies on their plans for APIs and are monitoring their progress. Through our engagement and the leadership of President Obama, the administration has implemented many policies that have and will benefit APIs. For example, in health, President Obama and the Department of Health and Human Services have created a plan for API health disparities that address crucial issues such as hepatitis B, diabetes, cancer, cardiovascular disease, and hypertension. The Obama administration has begun to address an important goal by increasing appropriate data collection among APIs. This has begun with a data standard policy at HHS to collect disaggregated data on race and ethnicity, so that we will be able to obtain data not just on Asian Americans or Pacific Islanders, but also for groups such as Chinese, Korean, and Vietnamese, and so on. You've just heard a lot about the Affordable Care Act, which in our view is the most significant game changer for the health of APIs in the last 40 years. As a researcher, I can tell you that in studies of health and health behaviors among APIs, having health insurance is the single most important factor that applies across all segments of the API communities. And you've just heard that up to 2 million APIs who currently do not have health insurance will benefit by getting affordable health insurance. The initiative has been conducting outreach to our communities to increase knowledge about the Affordable Care Act through blog postings and webinars such as this one. We have also conducted regional summits, including a Southeast Regional Summit in Atlanta, which drew over 500 community members and leaders from the Southeast states, and an emerging community forum in Oakland, California, with newly arrived populations such as Mongolians, Burmese, and Bhutanese to let them know about the Affordable Care Act. And the initiative has been working with HHS to ensure that API priorities are heard during the planning and implementation of various components. The one thing that I could say for you all is to also participate in Affordable Care Act planning activities. One of possible thing that you could do is to look into how the state exchanges are being set up and how you can represent the API communities in that process. As you may have heard, this past week, President Obama spoke to a national gathering of 1,000 API leaders at the Asian Pacific American Institute for Congressional Studies to let us know that our concerns are also his concerns. I want to thank you for your participation in this webinar, and so that we can hear from you, I'm going to turn this back over to Priscilla. Thank you.
Thank you, Tom. I hope everyone can hear me. Thank you, Kathy, Myra, and Tom for your presentations. At this time, we do have the rest until 1:30 Eastern for any questions. So As you see in the screen before you, if you would like to enter a question for the speakers, please do so in the question box. We've blown it up and highlighted it so you can make sure to enter the question in the correct box. We do have a couple of questions that have come in so far. The first one I'll just go ahead and answer. There was a question about whether the PowerPoint slides would be available after the presentation. And the answer is yes, we'd like to make them available as soon as they get cleared. And then secondly, there was a question about, more specifically, what are the benefits in the APA for Native Hawaiians and Pacific Islanders in particular. Is there anybody on the line who'd like to speak to that?
This is Kathy. I understand that not only the Native American Health Improvement Act was formally and more permanently authorized, but that a Native Hawaiian Improvement Act provision was also in the Affordable Care Act. For any further analysis on the Act and the benefits to Native Hawaiians and Pacific Islanders, at the Health Forum's Healthcare Reform Resource Center, we have a brief that provides analysis on the impact on Pacific Islanders as well as Native Hawaiians, and in particular Pacific Islanders in the Pacific.
Thanks, Kathy. I'll also add, at least for those who are interested in the impact of the ACA in the Pacific Territories, we also co-sponsored a webinar series with the Office of Minority Health, and those webinars were recorded and are posted on our website as well if you'd like that information. Please continue to post your questions. I don't see any additional questions at this time.
Digna Hassan asks, what's the strategy does ACA do for linguistics and cultural competence?
I see. Thanks, Kent. So there was a question about cultural competency and the Affordable Care Act and whether there are any advancements that are being made there. Myra or Kathy or Tang, would either of you
I
like
can
to
talk a little bit about that. This is Myra again in the Office of Health Reform. One of the main ways in which the law helps address cultural competency are efforts to diversify our workforce. I briefly mentioned it in the presentation, but the law invests in the National Health Service Corps, and the National Health Service Corps is a program that runs out of our Health Resources and Services Administration that specifically provides scholarship and loan repayment to students that are interested in entering healthcare careers such as medicine, nurse practitioners, nurse midwives, a variety of health professions. And the idea is that these students will commit to serving at least 2 years in an underserved community in exchange for that federal assistance via loan repayment or a scholarship program. We've been able to triple the size of the National Health Service Corps as a result of this investment. But what many people don't know about is that the numbers of physicians, of healthcare professionals from minority communities in the National Health Service Corps program is actually much higher than the general rate in traditional healthcare. So the fact that we have federal assistance in the form of loan repayment, in the form of scholarship programs, is making a difference to these healthcare professionals. And that, in turn, will allow us to diversify our workforce and make a real difference. So that's one opportunity. Second, last year we actually released our HHS Disparities Action Plan. Our Office of Minority Health led this effort, but really it highlights efforts across the department because reducing health disparities does not fall only to the responsibility of the Office of Minority Health, but it truly is woven into each of our agencies and offices' responsibility to improve the health and well-being of Americans. So part of that action plan really highlights how we can better work within the federal government to align our resources and share our expertise. So the Office of Minority Health can work with our other operating divisions and agencies to improve linguistic access. The law did create 6 new offices of minority health in different operating divisions, such as the Substance Abuse and Mental Health Services Administration. They have a new Office of Behavioral Health Equity, or the Health Resources and Services Administration. Different offices that can focus on how we can better incorporate cultural competence, linguistic access into our existing programs. And I think having those conversations, having advocates in every part of our department really will be able to move the needle on the importance of these programs.
Thanks so much, Myra. So unfortunately, my computer just crashed. Kent, could you call out the next question for us?
Sure. Fanny Tang asks, how do you answer ACA opponents claim that Medicare will not be expanded but cut to ACA? What are they referring to?
I'm assuming, oh, this is Myra again. I would assume that they are probably referring to the fact that we have cuts to Medicare. The opponents to healthcare reform often criticize the fact that we do have many cuts to the Medicare program. But we try to emphasize is that those cuts are not cuts to benefits that seniors have in the program, but to areas of the Medicare program that we know have been deemed inefficient, such as fraud and abuse within the Medicare program, such as overpayments to private companies that are supposed to be delivering care in a certain way and not giving us the outcomes that we expected. One of the best parts of the fact that we are implementing this law is the reality that exists with regard to the Medicare program and the fact that Medicare costs are actually going down. We are actually saving Medicare money, and we are actually doing that by also giving people the opportunity to save, their own out-of-pocket costs. This year, for 2012, the average premium for the Part D and for Medicare Advantage plans, they're actually going to be lower than they were in 2011. And for Part B, premiums are expected to go up as they do year after year, but actually they will go up far less than was predicted. So what we're trying to do with the Medicare program is identify the parts that weren't working, the parts that weren't delivering better care for seniors, the parts that weren't focused on improving delivery of care to seniors, and really reshifting our focus on emphasizing the seniors in order to have a sustainable Medicare program for the future. So, that's one of the challenges with implementation of this law is that there is a lot of misinformation out there. And the more opportunities we have to have conversations like this one are really a great opportunity to highlight the benefits of the law and give you all the information you need to educate others in your community, in your family, and make that difference so that people know what it is that this law means to our families.
That's really important to know. Thanks, Myra. Kent, can we have the next question?
Yes. In a state where AAPI populations spread out, what should be the structure and workforce structure should be?
When AAPI populations are spread out?
In a state where AAPI populations spread out, what should be the workforce structure should be?
A workforce structure. Well, I think that the challenge with that is that the Affordable Care Act doesn't really address that. The Affordable Care Act definitely has opportunities, as Myra talked about, in increasing the workforce in a diverse fashion, especially around primary care. But in a widely diffused population, it is a challenge. However, the standing laws and regulations on linguistic access, there are provisions for non-discrimination and enforcement around those language access requirements, so that even if someone is living in an area where there are not many resources, they still have a right to language access for their healthcare services. And the Affordable Care Act does protect those rights even more. That is one thing to keep in mind. There is also an unprecedented expansion of the Community Health Center program. And for many, many of our community members, as well as all vulnerable populations, the ability to access affordable and culturally competent care in community health centers is not only expanding already, but will continue to expand under the Affordable Care Act.
I just want to add that there's an emphasis on quality improvement throughout the Affordable Care Act, and I think that would be another way where organizations that provide care will be held accountable for cultural and linguistic access.
Thank you. Myra, do you have anything else to add?
No, that's great. Thank you.
Okay. Can we have the next question, Kat, please?
Yes, this is from Chujero Hernandez. Is there any issues, obstacles that AAPIs are facing which is unique compared to other groups?
There's so many. I think a whole host of different challenges, some of which are addressed by the Affordable Care Act, but some of which still remain needing to be addressed. So certainly the prevention access and utilizing preventive care. Again, Myra really talked about the expansion of prevention services. Currently, today, we have free preventative services that are available in an unprecedented fashion and will continue throughout. And accessing preventative services is really a challenge in Asian American, Native Hawaiian, and Pacific Islander communities. The language access question that was coming up before, because nearly 2/3 of our community is foreign-born, and a large proportion of those people, as self-reported, do not speak English well. And then even if you do speak English well, medical language is a whole other language in and of itself. So that the linguistic challenges will continue to be there, but as I noted before, the non-discrimination and enforcement provisions around language access will also help with that significantly. We also know that there are conditions, and Tung might be able to talk about this as well, where there are much higher rates of prevalence of certain conditions among Asian Americans, Native Hawaiians, and Pacific Islanders, and certainly the not only the Affordable Care Act, but in particular the Department of Health and Human Services National Plan for Action for Eliminating Health Disparities tries to address this in really trying to highlight the different conditions in which Asian Americans, Native Hawaiians, and Pacific Islanders have more highly prevalent proportions. In particular, hepatitis B. Historically, there have been high rates of TB, and then certain kinds of cancer, certain cancer sites. Tung, did you want to talk about any of those related things?
So just two quick things. I think it is a much more complicated conversation because, as we know, AAPIs are quite a diverse group. So there are many health disparities. If you look in the Pacific group, I think the ones that Kathy's mentioned has been very important. I think issues around obesity and diabetes, cardiovascular disease, cancer screening, and in a lot of API population, especially among the men, tobacco use and tobacco control. I did want to make one general comment about this, though, is that I think people, we're a strong believer in local control and local input. So one of the most important things in the Affordable Care Act is a lot of implementation is going to occur, particularly with the Medicaid portion, through the states. So I really encourage those of you who have questions that are very specific about your area or your particular population to learn more about the state, how your state is planning to implement the exchanges, and get involved in that and get your priorities heard.
That's definitely a really good point. I think we have time for one more question. Kent?
Yes, this is from Christina Nip. In the light of the Supreme Court hearing on ACA, should we be concerned that some of these changes mentioned that won't take place?
That's a great question, and one we often get. However, from the department's perspective, we are working to implement this law because it is so important to people across the country. And today, it is the law of the land, and we are confident that the Supreme Court will uphold it because it is constitutional. So we are continuing to work as we normally do with implementation in order to ensure that people across the country continue to receive the many benefits that the law makes possible, and that folks that will benefit from the law in the future will learn about the law and what's to come. So we encourage you to continue to work with us to make that possible.
Okay. So on that optimistic note, I'd like to thank the speakers, Ms. Ko, Ms. Alvarez, and Dr. Nguyen for joining us, and thank you to all of you for participating in today's webinar entitled The Healthcare Law and You, How Does the ACA Help Asian Americans, Native Hawaiians, and Pacific Islanders? We will follow up by email with any updates and postings from this webinar piece. Thanks so much.